to fit your budget and needs, and each gives you the freedom to access your money the way you want, online, through our mobile app, or with your debit card. It's your money and your choice. To learn more about the account that's right for you, stop by one of our offices or visit us at jcsbank.com. Jewett City Savings Bank, member FDIC.
Family owned and operated. That's something you don't hear too often anymore. Highway Campers of Plainfield is now 3 generations in and going strong. If you're looking to upgrade or get your first RV, contact the family that knows RVs, Highway Campers. They'll walk you through the process of finding the right RV for you and can even finance it for you. Visit www.highwaycampers.com and find your home on wheels. After all, home is where you park it. Highway Campers is a proud supporter of Griswold Youth Football.
Hi, my name is Dr. Katina Simmons. I'm the optometrist and the new owner of Griswold Eye Care, formerly the office of Dr. Joel Zuckerbrand. I would like to welcome you and your family to make an appointment today for an eye exam. Even though the name has changed, we are still providing the same family-friendly eye care as Dr. Z. We are located at 8 North Main Street in Jewett City. You can also find Griswold Eye Care on Facebook and send us a message. Don't forget that eye exams correlate to your whole body health too. It's not just new glasses and contacts. So come see me, Dr. Katina Simmons, at the all-new Griswold Eye Care, formerly Dr. Zuckerbrand. Hope to see you soon.
You buy better. Better it burns. Much better. So much better it burns. The right insurance at the right price. You buy better it burns. You buy better it burns. You buy better.
The Burns Agency knows your insurance needs can change with almost every season. The snowblowers get tucked away and the motorcycles, boats, and jet skis come out to play. Give yourself a minute. Stop. Think about what new or changing exposures are happening to you. Then call the Burns Agency. Over the phone, in person, or online, we're here for all your policy needs. Or better yet, give us a chance to earn your business with our top-notch customer service, strong coverage options, and unbeatable pricing. The Burns Agency, proudly serving Eastern Connecticut since 1932.
Better. Better it burns. Much better. So much better it burns. The right insurance at the right price. You buy better it burns. You buy better it burns. You buy better.
Your community radio.
Live from Main Street.
Mike Minarski and Rich Wasilick in the morning. And 80s all day and night.
SNSN.
Well, this is kind of weird. It's kind of different today. And it's because if you look at your screen, I'm surrounded by lovely ladies. Estrogen. Look out.
Watch out.
And I'm not used to this. I'm already stuttering and I don't know. And then Rich is over there going, So it's funny because Rich is not here. Well, he is here, but he's not because he wasn't supposed to be here, but he showed up anyway. Instead, we have a fine replacement and probably somebody that will end up taking his place. Kathy. It's Kathy Wassel. It just happens to be Rich's wife. Mm-hmm. And then look at this. Graduating from the chat room. It's Victoria. Hi.
Hey.
Wow, that was neat. It's like, hey.
She's louder in the chat room.
Oh, gee, thanks. I'm trying to be on my good behavior.
My God, you put her in the chat room and it's like, you son of a, like that. You bring her in here. It's like, hey, Victoria. Hey.
Nice. We'll get her going.
3 steps up in Z formation. God. So, are you Jen? I'm Jen. Look at this. See? Everybody's showing up.
More estrogen.
More estrogen. That is true. Huh?
I'm over there.
No, not yet. Not yet.
Okay.
No, yeah, we're good. So Victoria.
Yes.
It's fun. Like we recruited you outside of the chat room.
Pretty much.
So you were in our chat room just a lot, almost every day. Then you get like the banana.
Uh-huh.
You know what the banana is?
No.
Booted.
Yes.
Oh.
Yeah.
I got
called the banana.
Facebook jailed.
Oh.
Yeah.
A few times.
On TikTok they call it the banana, but
It
yeah.
happens to the best of us.
Yeah. Yeah. It was stupid.
What did you do?
Yeah, I was just gonna ask.
So a friend of mine has a barn down in Alabama, and her husband had his fishing poles leaning up against the wall, and a snake was draped over the top of the fishing poles, and it was a huge snake, like probably 6.5 feet long.
Okay.
So I commented on Facebook. I'm like, she goes, "What do I do?" And I said, "Burn the place down." Within
everybody
seconds,
says that.
Within seconds, Facebook notified me, "You broke our community
Community
standards."
guidelines, yeah.
2 minutes later, I was blocked. I was in Facebook jail. And then they said it was going to be 48 hours. It landed up being like 4 days.
Oh
And
my
I'm still
God.
restricted. My posts don't show up.
Really?
They show up at the bottom of a lot of people's feeds. And I have some groups that I'm kind of restricted in right now.
Oh my God.
Yeah.
I've never gotten the.
They nailed me
I
for
don't know
a
how
post.
because I can.
I've gotten it once, and it was I shared something from something else from another
Yeah.
group, shared something, and it wasn't until about 6 months later that they were like, "Oh," and I had to go back and look. I'm like,
I got a
posted that 6 months
ban
ago.
for 72 hours a few months ago for a post I made in 2016. I had shared a meme
Yeah.
in 2016.
Yeah. I've had that happen. I've had that
Hello.
happen where I didn't get banned, but it was like, take it down.
Mm.
So like, okay, so screw it, and I took it down. But I've never.
I don't even know how they found it because I've limited my past posts. Like
Yeah.
they're not supposed to even show up. So how did you
Mhm.
find it from 2016?
Because they're watching.
Watching, waiting.
They're waiting.
The only thing that's ever happened to me really and it happens on a consistent basis is copywritten music.
Yes.
So you know what happens a lot and I mean almost put it this way, just about every time we do a live sports broadcast, because somebody's playing something,
course,
or the music's on the loudspeaker,
Right.
you get dinged for that. And I'm like, and I every single time, I have to write in, what's your reason for, plead your case pretty much. Well, it's just music that's being played in the background. What am I supposed to do?
Yeah.
And I went off one day and I said, why are you even doing these lives? Why are you even, having the ability to go live for crying out loud?
Yep.
If somebody's going to play a song in the background, you're just going to knock them off. It's stupid.
Yep.
But is that the people? Is it Facebook or is it the licensing companies that are
All of
being
the
that
above.
difficult?
I'm sure.
Probably all of the above.
Yeah.
Yeah. So I don't know. That's all, but that's my thing.
We just need to start our own. Start our own social media. No rules. It'll be like the wild, wild west of social media.
We'll be on CNN, Fox, MSNBC,
Man, all of them.
Reuters, Al Jazeera.
That'd be perfect.
So what? Let me ask you a question since you're here. So what is? One thing I don't know is like, what's your background? Like I know you're on. Well, I'll let you because I don't know what you want to say or what you don't want to say. So.
I don't know. So I went to college. I was going to be a veterinarian. I had 4 years left, and then I met my first husband, and then I got pregnant shortly thereafter. So then I was training horses, had the kids. As the kids got a little older, they started doing a lot of activities. So I started volunteering. Like I did Young Marines for 10 years.
Oh, sure. Yeah.
I did Toys for Tots for 3 counties in the state of Connecticut for about 9 years. And then I started working with a group of friends that kind of keep an eye on nonprofits. So I do that kind of remotely.
So Mom Life took over.
Yeah, Mom Life totally took over. Then I got involved. We moved to Sterling a few years ago. So now I'm doing planning and zoning, Board of Ed, Republican Town Committee. I just...
You're busy.
Yeah.
Plus you
Plus,
around the house.
Plus I run the house. Plus I have my own business. I Breed corgis.
Oh, that's right. That's right.
yes.
That's right. And in your spare time, you sunbathe.
And yes, I try. I try without my neighbors peeping.
With their drone. By the way, Victoria will have her new OnlyFans account.
There may already be one. We don't know. I don't know.
Oh my goodness sakes! Did you see? I don't know if you even saw it. But I put up on my story a couple days ago on Facebook. It said, "Contrary to popular belief," kind of thing. Yeah, I do not have an OnlyFans account. There was a reason for that. So there's this lady on that I follow on TikTok. Retro Blonde is her name. That's Peaches.
Peaches.
Yeah.
That's Peaches.
That's Peaches. So I follow her because she has a lot of pretty good 80s content. That's really it. She has lists and that kind of stuff. Right. And she's just, smiles and stuff like that. Fully dressed, nothing, right? So then you look at it, it says, well, check my Instagram out. So I went over to the Instagram. Oh no.
It's the rabbit hole.
Well, I messaged you one night when you were on your TikTok because you had some crackhead on the other side, like in your
duet thing.
Oh,
and
I'm
God, you get them sometimes.
Dude, she was out there.
It's good entertaining.
Oh my God.
She was taking off,
you know how you can take off your bra with your shirt on? She was like doing that while she's on air with him, like sitting on her bed, munching on whatever.
Wrong website.
Yeah.
Wrong app.
Oh yeah.
Last night I was doing one of those battles against some lady. She thought she was a Viking. She had a hat with the the Grand Poobah horns.
What the heck? It takes all kinds.
I'm waiting to see him do makeup though.
No.
When you get on TikTok and you get to those lives, it's all these guys doing makeup.
Yeah, no. No.
$100.
No.
That would be entertaining.
That would be
that's not gonna happen. I will guarantee you that is not gonna happen. Although I did say to some lady last night, I said, all right, if you do one of these TikTok gifts, I will tattoo something somewhere.
Oh my God.
Nice.
Yeah. Basically, that's just to get people to shut up.
Yeah.
Because they're like mouthy and stuff. So anyway, getting back to the story. So I go back, I go look on her Instagram, and it's like, oh no.
Mm-hmm.
So I look at her content, and now it's just her. Not it's just smiling and whatever. And I'm thinking, oh, okay, well, it's different content, than what she's doing on TikTok. Then I looked at the hashtags.
Ooh.
Hashtag sexy mom.
Oh God.
Hashtag OnlyFans. Oh no. And honestly, I was telling Melissa this as we were walking the dogs yesterday. I said, this was one person that I thought was just pure, loved the 80s, and that kind of pop culture.
Mm-hmm.
And all she's doing is she's taking her TikTok followers and then trying to push them to Instagram.
And then to her OnlyFans.
And then to her OnlyFans.
So what's her OnlyFans page look
I have
like?
no idea. No clue. I didn't.
I think you have to have an app to get on there too. You have an app to get on there?
Probably.
I don't know.
Oh.
I have no idea. But
he's lying. He knows.
No, I do not.
Melissa, I'd be checking that.
My phone is open. My phone. I don't have any thumbprint. I don't have nothing.
Check the burner phone.
Right.
Shit. I don't have a burner phone. Damn. So
you got to start using those hashtags in your sexy mama,
Right?
OnlyFans. You might that might draw more followers to your 80s page.
Wow. I'll be wearing. See, you guys are talking about, we'll see. I'll give you $100 for makeup. Somebody said to me, why don't you just wear pasties? And I'm like, no!
Oh my God, that would be
Oh,
hysterical.
that would be hysterical.
Oh my God.
Scott
You got to
Pryor.
do that.
Scott goes, lies.
Yeah. Yep. That's what I'm saying.
Sorry, Scott. I found your OnlyFans page. As far as the social media network that you were talking about starting one, Scott says, I'm in for that.
Yes.
Perfect.
And Laura says, good morning.
Good morning.
And nice to see some women co-hosts.
Yes.
Yay.
It's the tax break. That's what it is. So because of the big dollars that I'm paying out.
Mm-hmm. There you go.
That's because what? Oh yeah. No, it is nice. Somebody else said it too. Said, why don't you have any ladies on there? And I'm like, because I've asked. And I said, and Rich is in the background over here. And I had said, well, I'd asked Kathy a bunch of times. Mm-hmm. And it's like she's not available because she works.
Mm-hmm.
She does have a job.
Yeah,
right.
Yeah, I do work, have a job.
Yeah.
And a lot of my meetings are in the mornings, unfortunately.
Well, that, and it's a lot easier getting men on because there's a lot less maintenance.
Yeah.
We are not high maintenance just because we have jobs.
Jen Gauthier says, ladies represent.
Yes.
It's a takeover. It's a movement. And but here's the other thing. We have another lady that's going to be joining us in just a few minutes. Jennifer Ceccarelli from Uncas Health. And we're going to be talking about, and she just got fresh numbers. Yeah.
Sweet.
So we'll have all that. She's going to talk COVID and monkeypox.
Good times.
Good times. Yeah. Monkeypox. That's a couldn't they have come up with a better name? Why monkeypox?
Because it grabs your attention. It
guess so.
Sounds ridiculous. So it makes you you gravitate toward it. Like, what the monkeypox? What the hell's monkeypox?
You get it from bananas?
I don't know. I mean, look, we had chicken pox. Maybe it's just an animal thing. Like, it's just
I don't know.
Huh?
Yeah, I mean, maybe.
Did it? It wasn't a penguin.
No.
Oh, that was one of the theories in the beginning that COVID started with bats.
The bat and the penguin got together on a hot night.
Yeah.
Boom, chicken, wow, wow.
Yeah, and the next one we could have penguin pox, and I mean, who knows? Could be
my goodness. Squirrels.
Squirrel measles.
These whoa, Scott. This is probably a little more accurate. Midterm pox.
Exactly.
Yes.
Moneypox.
Yep.
Mm-hmm.
Yep.
Jennifer says it's called that because it started in the 50s with an outbreak in monkeys.
Yeah, makes sense.
I just want to know who the first guy
Jen, I want you to start cracking jokes. That's what I want. I want to see you start cracking jokes. So, no, not you. It's actually Jen from Uncas Health going, who, me? Jen Ceccarelli's in the green room. There's nothing green over there.
Prepping. Yeah.
Scott says, I've seen that movie. Did you ever see Outbreak?
Yes.
I'm not a movie person, so no.
No?
Nah, I don't have the attention span to sit for hours and watch a movie.
Yeah.
I need quick hits.
So that's why you're a social media fan. Short attention span theater.
Yeah, probably. Because
Yeah.
I just like to scroll. And even he's like, how can you read that fast? I'm like, I already read it. Let's go. Move on to the next one. Next one. Come on. Yeah.
Huh?
Next.
Are you ready for Jen?
Sure.
I think we should bring Jen Ceccarelli in now, who is our guest this morning. And I could, what are you nervous about?
How are you?
Right, come right over in front of this microphone right here.
Don't worry, it took me a while to do my hair.
Oh yeah.
Yeah.
Well, it's nice and cool anyway.
You're going to come right up to it.
Okay.
Drop that down a little bit. Yeah, that's good. Okay. All right, Jen Ceccarelli from Uncas Health. How are you?
I'm good. How are you?
Good. So Patrick sent you.
Oh yes.
Usually it's him that
know.
comes. So what's up with him?
Patrick's very busy.
I know.
So as you know, the pandemic really set all the health districts back because all of our focus had to shift to COVID and illnesses, and a lot was expected of us. And we, quickly jumped in to start vaccinating and helping out where we could, and helping set up test sites throughout Connecticut, and just helping the community stay safe as much as we could. So now that, COVID is not as prevalent, I mean, we are seeing numbers bump up, but they're starting to get back to their routine duties like public health, food inspections. They have to help people figure out where to install pools and see if they're up to code and other things like that. And plus now with monkeypox, that adds another layer of issues. And then we have school coming soon.
I guess a lot of us don't realize this. You know what I mean? We don't. I don't think about it.
Yeah.
What about you, Victoria? Is that something that you kind of think of, and about like all the things that she has brought up? It's like probably not.
Probably not.
Yeah. Kathy.
No, I think when you think health district, especially lately, you think, oh, COVID. That's all they do is COVID.
Yep.
Yeah, I had no idea you guys were involved in pool inspections and things.
Food
like
inspections and all carnivals and fairs that have food trucks. They have to make sure that they're up to code. So we're serving food that's safe and not contaminated, right?
We appreciate that.
I only knew about pools because Chris Madden told me. We had a conversation one day about.
Oh, Chris is my buddy. He's a sanitarian. Yeah, Chris is awesome.
Yeah. You and Chris? Yeah, he's a good guy.
Yeah.
You don't think that he's the health guy driving up in his motorcycle filled with tattoos?
No, I thought he'd be blowing the pool up. You do public pools only, though.
Oh no.
You do private pools.
Private pools too.
Backyards and do pools?
Well, we don't do pools. We just inspect to make sure that they're far enough away.
No, they don't hand out the building permits.
No, we don't do that.
So, monkeypox came onto the scene, a couple months ago, a few months ago, just kind of like lingered, right? I don't really know. I don't know the exact date. But anyway, what is monkeypox?
End of May, I think. So,
what is it?
Monkeypox.
Where did it come from?
Western and Central Africa. So basically, it started in Western and Central Africa, and they found it in monkey colonies. That's where it gets the name monkeypox, right? So they were doing research, I guess, in these colonies. So I don't know how exactly the source is unknown, but a lot of people traveling, right? You think about international travel to these countries could have brought it back, through flying travel, or, think of what do you call them? Different rodents and, the fancy pets and animals people want to try to bring back. You don't know what diseases they are carrying either. So much is to be learned about it. But before this monkeypox outbreak, there were a few cases in the United States, but it kind of died off. And then we haven't heard about it until now.
All right, Rich. I know you're chomping over there.
Hey, I'm not the expert. I'm just going to tell you what I know.
It's almost election time, so
Oh, I don't know anything about politics.
Yeah.
deadly. It's not as bad.
No, it's.
I think you could probably
not,
correlate gas prices more to that because all of a sudden now, oh my God, it's under $4.
Yeah.
It's not deadly.
No, it's not life threatening.
You get a rash, right?
You do get a rash. So with monkeypox, it usually will start with what they call prodrome. That's the medical term. And that just means early symptoms. And those early symptoms could be flu-like symptoms like fever, headache, fatigue, muscle ache, backache, just generally not feeling good. And then a few days later, 1 to 4 days later, you can get the rash after that prodrome period. And it starts out as like a flat rash on your skin. It could be on your, I'm itching too. On your face, your nose.
All of a sudden, we all got
all itchy.
And it's, it starts there. It could also be in the genitalia area.
Oh, we don't have the pox.
No. But
why'd you turn your back, Rich?
Yeah, I just scared somebody up. But actually, it goes in stages, Mike. So it starts out as a rash, and it can turn into like pimples or lesions, and they look different at different stages. So it's very hard to detect. So if you have any new rash, just call your doctor and let them know that you suspect you have it. But thank you. I'm trying to be serious though. Yeah. So with the rash and the stages, it could last up to 21 days. And you're considered contagious with this rash lesions until the lesions scab up
Dry up.
and dry up. The scab falls off, and then new skin starts to form.
Okay.
So what our job at the health department is, we follow cases and contacts. We're notified within 24 hours, and we notify the case or contact within 24 hours. And we follow them through their course of the disease to make sure that they're isolating, which is basically the treatment for it right now. Because it's you can spread it through skin to skin contact, cuddling, hugging, kissing. Also, you can spread it through contaminated bed linens, towels, clothing that the person who had monkeypox was in.
So how is this different from chickenpox?
How is it different from chickenpox? That's a great question. And it's actually easily confused. So chickenpox has blisters, right? And the blisters are different from the monkeypox lesions in that they are thin. The skin is thin and you can break it, and it's like filled with a clear fluid. And the monkeypox progresses from a rash to a pimple to a lesion. It could look different stages. And the monkeypox you can't pop, where the chickenpox you can if you scratch it.
So it's like a harder membrane.
It's a harder skin membrane. Yeah. Absolutely. And also monkeypox has what they call umbilicated. That's another medical word I'm throwing at you, which basically means a belly, like it looks like a belly button, has a center to the pock.
Is it an innie or an outie?
Innie. It's an innie.
So chickenpox and monkeypox they're related in a way, but not.
But not the same family.
Right.
Not the same
So
virus.
the same but different.
The same but different. So
Okay.
monkeypox is from the orthopox family of viruses, and chickenpox is from the varicella zoster family. And also the difference is demographics. You look at monkeypox, the demographics are, although anybody can get it with contact of bed linens or clothing, the demographic they're saying now 90 is males having sex with males, right?
Yep.
Where chickenpox is primarily children, right? It's a childhood disease, although we
I had it when I was 5.
Yeah, I had it too.
Yeah.
It was funny. We got we were got
And you never get it
chickenpox,
again.
and our families put us all together in the same rooms.
Yes.
That's how they treated us.
Well, that was going to
Yep.
be my question: is should we be having monkeypox parties to just build up the
No.
natural immunity?
No.
Like, why is it so? If
It's more
if it comes
serious.
and goes, why is it serious?
It's serious because it's very contagious, right? On the skin, the lesions break open. You touch the surface that.
But
was-
poison ivy is the same way.
Yeah. So
Well-
I'm just what's the serious part of it?
Well, there's more data coming from science. They say that there could be a respiratory component. They don't know, but that respiratory component is right now face-to-face contact for prolonged periods of time.
From skin?
From face-to-face contact, talking, breathing.
You're talking about like droplets
Like
and
droplets,
that kind of stuff?
right, respiratory droplets.
kind of like
But
COVID?
not as bad as COVID.
Okay.
So when you're talking COVID,
here we go.
I know. So COVID is very contagious, right? On a scale of 0 to 10, it's 7 with the respiratory. They don't know how contagious it is, but right now they're finding cases that are spread through skin to skin contact.
Is there a death rate so far with monkeypox?
There is no deaths in the United States
Okay.
as of yet. There are more deaths over in Africa, but that's been there for a long time.
Yep.
So
It's interesting. It's interesting because, you talk about, I still, the big thing that I don't understand, and maybe I'm just not wrapping my head around it enough, but I just don't know why this is a national public
Right.
emergency.
That's what I'm wondering.
Yeah.
Why is it serious? What makes it serious?
Well, I remember having chickenpox and measles, and it was like, I got time off of school.
Yeah.
Okay.
And the mumps.
And you didn't have to isolate.
And the
you
mumps,
didn't have to do any of that.
The mumps.
Yeah.
So where does the national emergency come in? Nobody's. It's not lethal.
it's non-threatening. No, not life-threatening. I mean, it is painful though if you have it. Like listening to stories and people that have had it. The rash and the lesions are very painful, and there's a stigma too that surrounds it. I'm actually going to be on a webinar this afternoon about the stigma surrounding monkeypox because of the demographics. So,
because of homosexual males,
right,
they're
male having sex with male.
So, and why is that? If you can get it through bed linens and touching and cuddling and being in the same house with your family, and where did the male to male thing come from? Like, it doesn't seem to.
That's
mesh.
a question. Yeah.
Well, they noticed that the outbreak started in a group of males engaging in risky behaviors. I believe it was in London or somewhere in Europe, but that's where that comes from.
Okay, so not necessarily here in the U.S.
No,
Oh,
there were
okay.
2 children that had. Well, you got to remember we're traveling, right?
Yeah,
we go all over now. So, but as far as in the household, you talked about the children that had 2 children. The cases that I know that have.
You're talking about local?
Not local.
Okay.
They contracted it through household contacts, sharing the linens,
right? Yeah,
stuff like that. So, I guess more is to come about monkeypox. I don't have all these answers for you, so we're learning every day and trying to educate people as much as we know.
So, is it right now pandemic, epidemic?
No.
Where are we on that scale?
It's an emergency, public
Okay.
health emergency.
Okay.
So it's emergency, epidemic, pandemic.
Right.
Okay.
It's not freak out. No,
it's not freak out.
because it's very contagious. It's new, and it's very contagious. I don't know about a classification legally. I don't know about that.
Is it new?
She's like, I'm staying out of the political part of this.
Is it new though? Because you said it was back.
Well, I believe
it's not new.
before it was 1970 is when they had the outbreak in Western and Central Africa.
Okay.
Jennifer asks, isn't this an emergency because of the LGBTQ as they are currently the highest risk in the outbreak? I think the emergency declaration mobilizes funding and highlights the urgency to get this under control. No? Question mark.
Yeah.
So we don't really know the answer to this.
Well, and
that
and we can't really explain the demographic piece either.
Right.
Like it, I don't. Well, where's it coming from? I still don't
it's an
understand the
emergency.
So not being a part of the show today, Rich is a big part of the show. Have you noticed that?
Yeah,
Oh, okay.
no, you're making this very hard for me. So I don't really know why it's an emergency.
Yeah, that's not. I don't think that's not a public health question. I think.
Well, not for the nurse anyway.
Right.
Maybe for that's above my pay grade.
Okay.
But absolutely, it's an emergency for the LGBTQ community. Absolutely.
Jennifer says the emergency declaration is for the release of federal funds.
Yeah, of course. It's typically.
Thank you.
It's usually connected somehow to money.
Yeah,
it's always money.
So why should somebody get tested for it? I mean, is this like a lot of people? Yeah, I know your head's going. Victoria's like, what?
We're getting tested now.
I mean, yeah, you heard about COVID, I mean, stuff like that. But are we talking about being tested just in general for monkeypox?
No.
Or
No. So if you develop a rash or suspect you have monkeypox, like the rash with the flu-like symptoms that come first, I told you, you call your doctor and you let them know, and they will test you. It has to be tested by a healthcare provider. It's not a self-test. You can't go into any lab and get it.
What's the test?
The test is a swab. So they swab the rash or lesion, and the fluid from that is tested. It's sent out to state lab, and we have some private labs, I think, in the area, like Quest, and I can't think of the other ones. But you can't just show up at a lab with the test.
Gotcha.
Right? They have to be done by a healthcare professional.
Okay.
But testing is basically because if you were exposed to somebody and you have this rash, there is some treatment available for it.
Like, what is the treatment for monkeypox?
The treatment is isolation. Basically.
Oh, great. Kind of like COVID.
I don't want to hear that word COVID.
All
We're
right.
talking monkeypox right now. So,
and you gotta wear masks.
Some of that.
no mask.
Well, you
Lots
said
of bananas.
droplets.
I didn't want to
You
say the
watch
word.
it. You said droplets.
I did.
So
There
the
is a
next step is
small-
flatten the curve.
I don't know. I don't want to talk about that. I got PTSD.
We all do.
Yes, we do. So isolation until it resolves, like I said, that's the number one treatment. There is a medication. It's an antiviral medication. It's called TPOX.
Sounds like a rapper.
It does, right? I should have worn my sunglasses for that. So the TPOXX antiviral medication was actually developed for smallpox, right? So back to monkeypox being related to smallpox. And it's been approved for emergency use, like when the COVID vaccines came out, they were initially approved for emergency use authorization.
So not FDA approved.
Not FDA approved for monkeypox,
Right.
but FDA approved for smallpox.
Off-label.
Off-label.
Yeah.
So, that's something you have to discuss with the provider if you're eligible for. Most people with like weakened immune systems or, higher risk for death because of comorbidities would be in the category where they would give that medication to. For close contacts. So, we get a call, somebody's positive, they live here, this is their number. We call them and you have to do this risk assessment, talk to them. Who were you in contact with, in the last, 4 to 14 days. And when we do the contact tracing, we find out who the contact, yes, that's like COVID too, but it's important to find it early so we can stop it from spreading, right?
Mm-hmm.
And if you are a close contact, there is a vaccine available, but we have to help decide the risk as well because of the limited.
I was going to say the vaccine's limited, right?
Exactly.
Yeah. For now.
But, I know that the state of Connecticut is working hard to get as much as they can order. I think there's like 3,400 doses of the Jynneos vaccine, and they're ordering another 13 or 1,500 this coming week. So they're trying to keep it coming, but that's why it's important that everybody kind of gets funneled through the health department so we can do a thorough risk assessment and, kind of see who's needing it the most. Until we get more.
Your head's moving. I can see it.
I knew I should have worn my Be Positive shirt.
I think there's just so many questions. I mean, there's just so many questions, and after the whole COVID thing, and I think people are just done. We're just done with this, and then you have the monkeypox, and then we're talking vaccines again, and it's just like
it's exhausting.
It is. It's so exhausting, and I still don't understand the LGBTQ aspect of it. If it can be, transmitted through anybody, I don't understand why that group is being singled out. That doesn't make sense.
Well, anyone can get it,
right? That exactly.
Right.
So why is that group being singled out as a high risk if anybody can get it?
Right.
That doesn't make sense to me. But it's
only because they found it first in that community,
right? So it doesn't necessarily mean that that it's prevalent in that community. It's just that it was found first there. So. Who cares? I mean,
we need to do a better job about it.
Right.
Is it because it's really new? It's really
Yes.
still very new and it's
very
in
new.
infancy stage.
Infancy stage, still finding out more.
So say you go through you have a rash or whatever, and say you just have like one little lesion or something. You cover it up. Can you go to work? It's covered. Why are we isolating for 21 days?
That's a good question.
I mean, people can't do that. They can't be out of work for 21 days. They're not going to do that anymore.
Right.
I think people are so over that.
There needs to be more clarification on that for us as well as medical professionals.
Sure.
But this did come up in a question with my colleagues. And if you have to go somewhere to seek medical care, right, you can't isolate.
Right.
You can cover it up. But, that's not good practice, right? Just like going to work sick is not good practice. So how are we to distinguish who's going to do that? I can't tell you that, but I get what you're saying.
Yeah,
I do.
I guess no, I don't know how I want to say this because I don't want you to think that, this is coming at you because it's absolutely not.
Where's Patrick when I need him?
But I think as a society, and please tell me if I'm off the train here. As a society, we are so programmed right now with what COVID was, is, can be, will be, won't be, whatever, that we see or hear something else coming along down the pike, along with the same thing like stop, but it's not lethal. It's not this, it's not that, but you got to stay home for 21 days. So I guess I'm not grabbing that one yet because I know as a kid, I know this is going to sound really more melodramatic than it really is, but
no,
I would get poison ivy all the time. And one of the things I heard about poison ivy, or I've learned through the years, is that it's through the leakage.
Right.
And whatever is contagious is actually beneath the skin level. And that's how it's fairly contagious. Is monkeypox that much more contagious than, say, poison ivy, poison oak, when it's open?
That's a good question.
So I don't know. Yeah, I mean,
well, that's what I was thinking with the chicken pox. I remember as kids we'd have chicken pox parties.
Yeah.
Get over it, be done with it, move on, and that was it.
Right.
So,
I mean, also just it's important to distinguish that the rash has different stages, right?
Mhm.
It starts as rash, moves like pimple-like, and then lesion, and then it opens up, scabs up, and sloughs off. So that's the difference between the pox or the blisters from both of those.
can you be reinfected?
Can
Once
you
get
be
it? Once you get it
reinfected?
once, can you get it again? Or
That's interesting that you brought that up.
Or can you
That's
get something else
that's a
down the
really
road,
good
like
question.
shingles? With chicken.
Well,
pox?
like
Can
with
you-
chickenpox,
because I asked you about that, about shingles.
there is a chance, I guess you could, right? Because that's how viruses are.
Yeah.
So if before 73, most people were vaccinated for smallpox, right? And smallpox has been eradicated.
Mhm.
So if you happen to have the smallpox vaccine, it is said that you will have some immunity to monkeypox because it's in the same virus family. But if you are a close contact of somebody, it's recommended to, possibly get a booster dose of the Jynneos vaccine, which is for monkeypox. So.
I just read smallpox came back too.
Oh, don't say
I
that.
read up. I know the media is incredible. I think a lot of this has to do with the media grabbing on the stuff.
Yeah.
And
I haven't heard
sensationalizing
anything
it,
about
yeah.
smallpox other than it's related to monkeypox.
What do you think, Victoria?
It was 1 hour.
I'm over it. I'm over it. All of it. I'm done.
Yeah.
I'd like to say
I'm
me
done.
too, but it's kind of paying my
Right.
bills.
It does. Yeah, I know.
She's looking, you can't see Victoria because she's off camera, but she's got her hands in her pocket going, I'm effing done.
I know. I really am.
If she was in that chat room, boy,
My-
my hands would be going.
We went through it with the COVID and having a child in school and a husband who encounters 7,500 people a day, face to face.
Was it work at Fenway?
No, down at the Dominion plant. They have their-
Dominion
during
Energy.
during their outages, they have like tons and these people are coming from all over the country, and you're gonna get COVID, and oh my god, yeah, it didn't happen.
Yeah.
The kid at school who was wearing masks all the time got it 3 times in 1 year. So
yeah,
I'm over the warnings and the
It's
we'll do our own thing.
Well, that's
We're
it.
good.
I mean, when I think so many people, when the sky's falling, the sky's falling, the sky's falling, the sky's falling, you get to a point where you're like, okay,
done.
yeah, I'll believe it when that actually falls.
Yeah.
Yeah.
But in all fairness to you, also, you work at the health department on the not federal, state, you're on the local level. So
Mhm.
you're
Correct.
just getting your marching orders from the
Correct.
Yeah, your stuff comes down from the state, which comes down from the from federal.
Yep.
Yeah. All right, so I think we've beaten the crap out of monkeypox.
Thank you.
But I'm glad that you were very thorough,
Mhm.
so people can go ahead and reference this podcast, show, whatever you want to call what we do anymore.
We have all the information on our website, uncashealthdistrict.org.
And you said there was a webinar today about
At
the
1 o'clock,
demographics.
Yep, about the stigma.
Mhm.
Okay. Let's talk COVID.
Let's not.
No.
Why the hell? I think
No.
we've talked about beating a dead
COVID
horse. We are-
schmovie.
Yeah.
What's the latest update? What's going on with it?
So we are seeing less cases this week, right? Every Thursday, the state of Connecticut has the data portal where they post the surveillance and statistics, such that again is above my pay grade. But I do look at it and pay attention to it because I have to. So it's 14% for Griswold positivity rates.
From testing?
13
Of
of
testing.
positivity rate of testing.
But but people that are testing right now it's not just random Joe that's going to go test. It's people that think, oh, I might have it.
Right.
So you're going to have a higher rate anyway.
Right. And it's also, we're still doing a lot of home self-test kits too, which are not reported unless they're verified by the lab test, which is the PCR. So Griswold and Norwich are 14% positivity rate, and Connecticut, I believe, is in 20%. which, I think it's good. It's better. We're seeing less hospitalization, less deaths. And the deaths that we are seeing are from elderly people or people who have comorbidities and mild to severe immunocompromised. So it's better. And the people who have been calling us that we've been talking to, and, we're still doing our clinics, they call and ask questions about where to get tests and this and that. And I can talk about that more, but they're reporting mild symptoms like allergies, like cold-like symptoms. And they never thought they would have COVID, and scratchy throat, sniffles, runny nose, cough, chills, fever. But they're generally getting better in 3 to 4 days. But, and yes, there are breakthrough cases from vaccinations, but it is a milder disease. It's the dominant variant. I'm sure you guys heard about Omicron.
Mm-hmm. Sounds like a superhero.
And I feel like my sunglasses got to come out again for that. But so the Omicron variant has like 37 lineages or subvariants, and they all seem to be milder right now. What is important to note is that everything's I feel like they're talking about monkeypox and not so much about COVID, because we're waiting to see what happens in the fall, right? Because fall comes flu season, respiratory season, as you know.
Numbers are going to go up.
And it's elections.
Well, I don't know about that. So
in November.
Come on, let's not politicize
November
this.
9th.
Just
mask
saying,
on.
yeah. Just saying. School starts and then elections are in November.
And so we're ramping up to help schools by getting some self-test kits so we can help distribute. I know the CDC and the FDA, they also are going to be developing websites for people to go online and order like 4 or 8 kits per person per household or something like that. So, and you can also get them at pharmacies with your insurance card.
So will they be testing the kids at school?
I don't know that. That's a good question. I think that will
have the test kits.
Is
that what you said?
The schools can distribute the test kits out to their families.
Oh, okay, gotcha.
That's what they did last year. I don't know. I don't want to answer for them
Yeah.
because basically it's going to be what they decide to do.
Mm-hmm.
But we are going to be there to help them, navigate through whatever they need if cases do go up. So the new guidance for schools, since we're talking about that, the SDE and DPH. So SDE is the Department of Education and Department of Public Health.
And Miguel Cardona, he comes from Connecticut.
Yay!
Yeah,
so they have sent out new guidance to schools, and the only difference basically is with the new school guidance for the new year is obviously stay home, test if you're sick, right? That's kind of common sense, but that's hard to do sometimes. But they want the family, they have this strategy called Test, Mask, Go. Okay. So in order for kids to get back to in-person learning, right? So we don't have to stay home all the time if you're a close contact, because the whole classrooms were going home. Remember, it was ridiculous. And I mean, it was what they thought necessary at the time because it was decreasing the spread of disease. So now what they're saying is they're leaving it up to the school districts to decide. And I'm sure they're all going crazy right now, developing policies and deciding what they're going to do with this. And it might change next week too, but I'm just keeping you in loop to what I know. So the Test, Mask, Go is if you are sick and you have a fever and you're vaccinated, to isolate for 5 days, stay home and isolate for 5 days. As long as your symptoms are improving, you can return to school after the 5 days, but wear masks so you decrease the possibility of spreading.
On the 5th day or after the 5th day?
After the 5th day, Mike.
And then how long do you wear the mask after the 5th day?
For 10 days.
Another
So
10
5
days
more
after.
days.
Oh, 5 more
so
after the 5th.
total
Okay.
of
Gotcha.
10 days quarantine. But if you're identified as a close contact and you're not symptomatic, or you have mild symptoms, and I'm talking mild symptoms like no fever, basically. So sniffles, cough, wear a mask though. And they want you to test every day.
Cindy just says in the
theory.
room, because that's how my daughter was last week, pretty mild. She was feeling great by day 3 or 4.
Good. Yeah. Like I said, people are getting better quicker.
I tested positive for almost 2 weeks.
Yeah.
I had nothing.
Yeah. Well, some of the tests are weird how they work. You can test positive for up to 90 days.
Yes.
They
I've heard
say.
that, yeah.
Yes.
But if you're in question of the self-home test, go get a PCR or a lab test.
Gotcha. Now, Victoria, I was curious about, like, she was talking about school districts. How was that like in Sterling?
Our school district, we never shut down our school like totally and completely. We didn't go totally remote. Our kids were in school.
Nice.
Which was fantastic. It was challenging. And we had a few classes, but we had put them in like little groups. So like the whole class didn't have to go out, which worked out well for us.
That's good.
Yeah.
That's good.
I mean, we don't have a huge school. There's only
Well, I was
like
going to
300
say
kids.
it's a smaller community.
Yeah. It's K through 8, but it's only like 300 kids.
Sure.
Yeah.
That's what K through 8 used to be like at Griswold.
Really?
Oh yeah.
Really?
Oh yeah. Yeah, we had like 2 teachers for this, 2 teachers for that.
Yeah.
Wow.
1 teacher for that.
We have a beautiful school though. I mean, like it wasn't built that long ago, and we have good ventilation, which was important, and we have a lot of room,
Right.
so we could spread people out.
Well, to implement something like that takes a community.
Yeah.
So
Yeah.
that's impressive.
Yeah,
Good for
it
you.
was good. Yeah.
So what do you think? Where do we go from here between with? I mean, and I think in a lot of this, we probably haven't been fair to you, because like
We're kind of picking on her.
I should have worn my
Trying to-
sunglasses.
Killing the messenger.
yeah.
That's all right. I got big shoulders.
What happens next? I mean, we just keep waiting to hear what happens with monkeypox. And
Yeah.
go from there.
Yeah. Wait to hear more. I'm curious to see where, the other modes of transmission, what science is going to find out with that. It's not classified as an STD or STI, sexually transmitted infection, because it's not found in, semen or vaginal secretions. But
We can say that we're big. We're adults here.
I'm scared.
Yeah. Vaginal.
Mike
likes that word.
No, it's not that. Vaginal. We can say that.
It's going to be his next hashtag.
Right.
On his,
Hashtag
OnlyFans page.
Hashtag vaginal.
Do you have an OnlyFans?
No,
He does.
We're
He
spreading
does.
it out.
He denies it, but
He totally does.
He's got it.
So yeah, Mike, I agree. We just got to wait and see. Be careful, be mindful. Everything I talked about. If you have any questions, give us a call at the health district. We'll be glad to walk anybody through, share the knowledge that we have. We have 3 nurses, so we often get together and talk these things through. We don't make decisions on our own. It's always collaborative with, of course, Patrick and the Department of Public Health.
Yeah.
So staying home when you're sick, flu season's around the corner, get your flu shot, continue to vaccinate. Vaccines are still available, Moderna, Pfizer for 6 months to 5 years. And then we have anybody 5 and up can get boosters if they're eligible, for the time period. And then adults over 50 can get a second booster if they're 4 months after their first one.
Yeah, I had
And
heard.
first responders or something too, right? Weren't first
I don't know.
responders part of that?
Well, they were back in the beginning when
Okay,
it
not so
started.
much now.
So they were prioritized, it went elderly,
Mhm.
right, over 70, I believe, and immunocompromised, and then the healthcare professionals, because we're obviously taking care of these sick people. So, but that didn't happen the second round.
Okay.
Sorry, Lou. I love you.
Mhm.
Who? Oh, okay.
You'll lose 50, right?
I have no idea.
Yeah.
No.
So it's age. You have to be 50 or over.
I'm not sure.
Gotcha. Is there anything else that we should talk about or mention? That
Any other
is-
viruses on the horizon that you've heard
Yeah.
about?
I don't
that- what's
know.
coming after monkeypox?
I hope
Should we
not.
prepare now for the
Well,
next one?
I
that's
think
gonna be
we
coming
have to
out?
learn to coincide with viruses.
Yeah,
They've been around. We're
exactly.
still here.
Yes,
We're still
exactly.
evolving. We're still living.
Yeah.
Exactly.
I have one question. It's a real one. But,
Yes.
do you see the flu coming back, number wise?
I have not seen any flu. Actually, our flu cases last year were very low. Everybody was in masks, right? We were doing all these mitigation, social distancing, quarantining. So I don't know what the anticipation is for this coming year since the masks have been off. But the good news is that a lot of people are vaccinated, and the word is out now about getting flu vaccines. So we are prepared to start vaccinating for flu come September, mid-September.
Isn't it weird that the flu was gone.
I don't know if it's gone.
No. I'm talking about
The
during
numbers.
COVID.
You mean the numbers?
This is what I don't understand.
They
It's
were
like
testing for it,
right?
Unless
Got it.
it was
They were
not
testing
COVID.
for COVID.
Right.
That and everybody
If it
got
wasn't COVID or any other respiratory illness, they would test for flu.
that and they locked everybody up, so I don't think that's what it's spread.
Gotcha.
Yeah, literally everybody was stuck in their
But
homes.
now I worry, and this is my forethought. Now that everybody's back together, people are going to start getting symptoms worse from all the other diseases they were locked up.
Well, that's what I
Because
worry
they're
about is
limited.
everyone's immune systems are down because
Well-
they've been locked up for a couple of years. So, you haven't been exposed to a lot, over the years, over the last few
So
years. So
weird
now
stuff's gonna start coming out.
like
Yep.
now we're going to find people are going to be more sick this coming season.
Well, hopefully
because
not.
everyone's immunity is shot. No one's been exposed to things, and that's what I worry about.
Yep. I said the same thing in the beginning. We put the masks on. It's going to be hard to get them off.
Mhm.
But that's what the guidance is.
Well, that too. Yeah.
All right, Jen. Thank you very much.
You're welcome. Thank you
Coming.
guys.
Thank you.
Sorry for the beating. But
You handled it well.
I'll just ask for a pay raise.
yeah, no stipend here.
Yeah.
Thank you.
Thank you.
Thank you, Jen.
Thank you.
Tell Patrick we said hello.
I will.
All right. Come on back, Victoria. So, what you thinking?
That was interesting.
It is. Thank you, Jen.
You're welcome.
Bye.
Say hi to Chris.
Have a great day.
Thanks.
You too.
She handled that very well.
She handled that
did.
very well. She
did a great job. That was trying to not make her feel like she was in front of a firing squad.
Some
but
of those questions and comments were straight between the eyes.
yeah, I mean,
You
but
know,
but
so-
it's what you want to know. I mean, there's so many questions when it comes to all of this health stuff, and there's so many, you have the conspiracy theories, you have the, facts versus the misinformation. It's having somebody here that's working right in the middle of it, you have questions.
Right.
Yeah. Especially, and I think we tend to forget sometimes, like when people like that come in, like they're the authority as far as the information that they're getting.
Right. Yeah.
The information that's coming down from state, federal, however they're disseminating this information out to the public. And, I saw one look on her face was like,
Help me.
so, but you're right. She did handle it very,
She
very
handled it
well.
really well.
Yeah. Very good. Yeah. She was a tough lady.
You could tell she was a little frustrated with the whole COVID thing too.
Yeah.
Oh, yeah.
I'm sure they all are.
Yeah.
I think everybody is, yeah.
Everybody,
I mean,
everybody's got just done.
We're like beating a dead horse here.
Yeah. Just because you work for a health department doesn't mean that you're not going to eye roll stuff going,
Right.
oh my God.
Right.
Mm-hmm.
No.
Well, I think that's passe now.
Well, that's what I'm saying.
Oh, there's places you go and people are wearing masks
We just came back
and
from-
multiple masks.
Yeah.
Multiple.
Right.
Driving down the road.
we just came back from Washington, D.C.
Yeah,
There were a lot of people, 50%.
Yeah, I would say in DC there were
Mhm.
still masks, gloves. A lot of people still wearing them.
Well, that's probably because of the immigrants that are coming to DC on the buses right now.
Yeah, right.
I'd be
we
wearing
didn't
masks
see any
too.
of those. Now that I think about,
Well,
we
they're
didn't
going
see
to New
any.
York now.
Oh, okay. I was gonna say we didn't see any bus loads coming into
They're
DC
spreading
while we
them
were
out.
there. Yeah,
Go to
I
DC,
did-
go
I
to
did-
New York,
yeah,
go to
heard
DC,
that.
go to New York.
Yeah.
So, like, here's another, and this is something that is a thing, and I've heard this in multiple situations, and not just even my own. It's like folks that just have babies.
Mm-hmm.
It's like, mask up.
On the baby, they're putting a mask.
No,
on.
no, no,
I'm
no, no,
kidding.
no, no, no.
Oh, around the
I'm
babies.
kidding.
Yeah.
Yep.
And I totally get it.
Well, you have a new.
Yeah, who I will see in about 2 hours.
Aw.
Flip side,
Huh?
I'm saying on the flip side,
Maybe
now
3
you're not
hours.
preparing that baby for the future.
Right.
You know what I'm saying?
Well,
It's not being exposed to anything.
Unless they got
but the baby
pre-existing
can't be, but the baby, or babies that, have just been born can't be vaccinated until they're 6 months old.
Yeah.
Right.
So, but I know of at least 4 that have the same type of policy guidance for their own
Yeah.
child right now.
Mm-hmm.
So it's like,
Yeah.
I get it. Plus,
Yeah.
he's too damn cute to pass up. So. Anyway, so what'd you think of your first shot here?
It was good. I thought, yeah, I don't know.
I think there were a couple of times you just wanted to let loose.
Oh, I was like, seriously?
Yeah.
Yeah, it's hard.
Yeah.
It's
Mm-hmm.
hard.
It's different than when you're typing at home.
Yeah. Well, I can backspace and like delete. Like I do a lot of that. Like some of the comments I've had for you guys were like, "Oh no, I can't do that. Nope, back out of that."
See, but here you can't.
No. I'm trying to be careful. Stop
you
talking
did
about
great.
COVID.
Yeah.
We'll be fine.
Gas prices are down.
Don't mention gas. Don't mention Brandon. Don't mention.
That was the stupidest thing ever. The whole "Let's Go Brandon" thing. That was the dumbest thing
what
ever.
that was
Completely
that
disagree.
reporter-
I love it.
That reporter was trying to cover
No, that was
something
funny.
up,
That
and she
was
quick.
very quick on her feet
And
with that. And it
yay
just,
her, and
Yes, it just
I think
caught
it's
on.
hysterical.
That is
It was funny.
fine. But
Yeah.
the people with the shirts,
Oh yeah, that's
and you know one thing,
overboard.
You're just jealous because you didn't make those shirts.
Yeah, I know.
Copyright them.
Why?
Let's be
'Cause-
honest.
Why? Because there's so many people in Jewett City, Griswold, Sterling that are buying shit.
Hey,
So-
I buy stuff.
Yeah, you do.
I got a Bite Me shirt. I got mugs. I got a Christmas tree ornament. We got a
This
hoodie.
is one of the reasons why I'm building the national social media. Can't survive.
Yeah.
Can't survive on local social media at all.
No.
So
This is a tough area of the state.
Mm-hmm.
I don't know. I've said it a million times.
East of the
This-
river.
Support
Yeah, east of
local
the
before
river.
they're, and I don't mean just me. I'm talking about everybody.
Yeah.
Support local till there's nothing local left to support.
Yeah.
Yeah.
You know, and then everybody's going to be throwing their hands up in the air going, "Oh, what the hell happened?
Mm-hmm.
I was going to support the bakery, but
Yeah.
the bakery didn't do it. It was there. I would have supported them." Bullshit.
Mm-hmm.
Yeah.
Yep.
Because the bakery did go in.
Yeah, I know.
And all those people on Grizzle Dow.
I don't know. They supported the bakery that wasn't there initially. I mean, those lines out that door. Oh my God! If you didn't get there first thing in the morning, there was nothing
Yeah.
left by the time you
Yeah.
got through the line.
You
You
know, when I was
know?
a kid, my father, we would go to church and then we would go over to Aramoni's,
Mm-hmm.
and most of the time it was about the bread in
Yes,
the morning,
the
Sunday morning
bread,
bread. Because
yes.
they have a slicer right there. But there was.
Yeah.
It was a line. and it was a
out.
thing.
Yes.
You know, and God forbid you went to the 11 o'clock
Oh,
mass.
forget it.
because you were
There was nothing
screwed.
left. Mm-mm.
Right. But
Yeah.
the line was twice as long at
Yep.
that point.
Yeah.
So
Yep.
now we're talking about bread.
I was gonna say we do need a
Oh,
bakery.
there's a new place that opened in Canterbury, in the plaza where Cumberland Farms is.
Oh,
He's-
okay.
He's making bread,
Oh.
only bread, and he only does like 2 kinds a day. And
Mm.
supposedly it's fantastic.
Oh.
Yeah,
Mm.
Little
Have to check that out.
River Baking Company, I think it's called.
I haven't even heard of it.
Yeah, he just opened, and everybody
nice.
is like raving about it.
Have to check that
Yeah,
out.
Check
He's
it out.
on Facebook, like the hours are listed on there.
Check it out.
We have a new one here in Griswold too.
Oh, really?
On 138, I think,
Mm-hmm.
down by the town garage. They do grinders and things
Oh, is
like
it the
that.
lunch place?
Yeah, I think they do breakfast now too. But they're
They had
fairly
some
new. Breaking
unusual-
bread.
Yes,
Breaking
They
bread.
have some unusual combinations.
Yep.
This inglorious free plug brought to you by Kathy Wasilek.
Sorry. Sorry.
I mentioned
Uh-huh,
bakery too.
But it was support local. You gotta support local. Right?
You can. Well, why should we should
Following your lead.
advertise?
Following your lead. Sorry, scratch
We should.
that.
We should advertise.
Reverse it.
Let's just not post on Facebook because
Sorry,
no,
my
no,
bad.
no, I don't care. You know how many people, how many businesses post on Facebook because it's free,
Yeah.
and then they go out of business, and they go, "What the hell happened?"
Well, if
Right.
that's their only means. Yeah. I mean,
Exactly.
but I think it definitely should be part of it, but not the only.
It should be a supportive
Right, yeah.
part of it.
Mm-hmm.
You know, there's so many other things that you should be doing.
Yeah.
And
You
people
got to
don't.
get it out there.
And it's sad because like in the 8 years that I've been here, I've seen so many businesses come and go, come and go,
Mhm.
come and go.
Right.
And why? Because Facebook,
Mhm.
you know, and I'm not bashing Facebook, but Facebook, you know, only sends your posts out to a small sect of people.
Mhm.
You know, that, you know, unless you're boosting that post, it's not going out.
Well, you got to make sure it gets onto Grizzled now. Then everybody sees it.
Yeah.
I can't even get onto Griswold now.
You are missing.
I keep trying and trying. I used his name and they said, "Oh, nope, you can't come in."
Really?
Yeah, I've tried because I don't live in the town, evidently.
There's
there's a
There's
slew
a
of people.
ton of people on there that don't live in town.
I don't know. I can't get on.
Strange.
Just say you
The laughs. The laughs.
look, open a troll account.
I need to because
Uh-huh.
when things like that happen.
Yep. Come up with a different name. I have a troll account. It's not my name.
Oh, great.
That's how he's got his OnlyFans.
Yeah,
Exactly.
exactly.
I do not.
He's got that little P button on his Facebook page. Pay
Got
me
that
direct.
verified check mark.
Yep.
All right, Victoria, thank you for coming, man. You got to come in. I think we'll have some conversation, just you and I, one day in here. You'll just go. No, it'll be fun. And Kathy, thank you.
Yeah.
Did you have fun? You seem to have fun every time you come in. So. Very good.
Girl Thursday.
Right?
Yeah.
Girl Thursday.
As long as I don't have meetings.
No. All right. So tomorrow, we hope Paul will be back. Paul is been not feeling so well. He's had a back problem, all week, and he wasn't able to make it Monday or Wednesday. So maybe tomorrow he'll be able to come in, and it's
He's doing better.
Is he doing? Oh, you did? Okay, good. Because we've been worried about him, and we haven't seen him, and hopefully we'll see him tomorrow. If not, we'll see him Monday. But keep Paul in your thoughts. That his back will feel better. So, thank you, Victoria.
No problem.
Whatever, Kathy.
Yeah, whatever.
Hey, Rich, thanks for not showing up.
Anytime I can't help.
See you tomorrow on SNSN.
Life is full of choices. At Jewett City Savings Bank, we can make one choice easy, finding the right checking account. We offer a range of affordable accounts to fit your budget and needs, and each gives you the freedom to access your money the way you want, online, through our mobile app,